Hello viewers, today too we are back on Donkor TV. We just want to thank everyone and appreciate everyone that has been subscribing to our channel, supporting us in every way that you can. We are still encouraging everyone to keep supporting, subscribing to the channel. Today we have something special for you. We know that a good life is a life that is lived really well and in good health. Today we've got our brother here, actually a Ghanaian by birth, and then he lives in Australia. He's in the person of Dr. Andrew Donkor. He's got his PhD. If you can read at the bottom of the screen, you can see that he's a postdoctoral research fellow in Greenwich Hospital in Australia. He's also a cancer researcher in the University of Technology, Australia. That is it UDS? UDS, Australia, Sydney. That's right. Okay, so today we will just introduce, as I've introduced our brother to you, I want us to just stay tuned, because what we're going to talk about is cancer, a very deadly situation that nobody really know much about, but he's a specialist in these areas and many more other areas where his research has taken him into. And we are really proud to have our brother here with us. And today we introduce Brother Andrew. He's going to take us through cancer in general, and then we'll throw a few questions, try to represent you back home watching this online or live today, so that if any question that we are not able to ask here, you can write at the bottom in the comment section, and we will respond to you. He will respond to you appropriately as a professional, and where he requires further information from other specialists, he'll make sure that happens. So today, stay tuned as you stay with us on Donkor TV. We present Brother Andrew. On to you, brother. Please have the floor and let us roll.
Okay, thank you, Koda, for inviting me. It's a pleasure joining you. Like you said, I specialize in cancer treatment. I have over 8 years experience in using radiation to treat cancer patients, and equally I have more than 10 years experience in cancer research, both in UK and in Australia. So today we are going to talk more on cancer in general. We want to know what cancer is, what are...
Can I disturb you for a minute? Can you actually introduce yourself properly to us? Like, what has been the journey? What brought you to this point? What have you been doing in the past? I believe viewers would want to know where your build-up has been from. But before he does that, we've got Sister Margaret. Please, can you just introduce yourself?
My name is Margaret Inchubwesiako. An aspiring nurse, registered nurse. And I'm here today to learn more, to facilitate my education. Yeah, that's why I'm here today.
Awesome. So yeah, back to you, Brother Andrew. Please tell us about your journey, where you've been, and then you can continue with your presentation.
Okay, so I had my basic medical education in University of Ghana. I completed in 2010. Then I worked in Kolebu Teaching Hospital from 2010 to 2013. Then in 2013, I moved to UK to pursue my master's from University of Southampton. Then after 2015, I moved to Ghana, in between Ghana and South Africa. Then finally, in 2016, I made a transition from Ghana to Australia to pursue my PhD. So I've been in Australia since 2016. At University of Technology, Sydney, where I did my PhD that focused on making radiotherapy accessible to low and middle income countries. And currently, I'm working at Greenwich Hospital as a postdoctoral research fellow, where I evaluate service improvements to ensure patients receive the quality and safe palliative care services that they need when they are approaching death.
Wow, this is amazing. In fact, I think that is a full, your journey is a full lecture.
Yes.
So you've got all that you need to be able to inform our listeners, because listeners, I believe today we've got what we need. One of the things we need, because a good health lies in a good body, and a sane mind is in a sane body. And then if you have a sane mind and then your body, your health is not the best, everything you've ever worked for, you can't even enjoy it. So we thank God that He has blessed us with you today. So now we can move on, as you've given us your background, and we know that. So it means anything about cancer, we are at the right place. So viewers, send through your questions, send through your concerns, anything, any aspect of cancer. I know this brother really well, and I believe that whatever information you need is available. Stay tuned as we hand over to Brother Andrew to educate us. So keep listening. Anything he says that you don't understand, please bring it on. Bring it on. Thank you.
So you are welcome to Cancer Line. Today we are focusing on general cancer. We will learn the basic signs and symptoms that you should look out for, and what are the common treatments for cancers in general. And it's even life after cancer diagnosis. That's a question that hits most people. Do we even have a cure for cancer? And if there is a cure, how can I assess that treatment? So most of the time, the question that emerges, who can actually get cancer? Who can actually get cancer? Is cancer specific to certain group of people? Is cancer for only people in developed countries, in the Western world? Or cancer is not part of those of us from Africa? That has been a misconception that cancer is mostly among the rich people. But I want to tell you that no, and everyone is at risk of developing cancer. The young, the old, males, female, everyone is at risk of developing cancer. There are over 100 types of cancers. There are over 100 types of cancers. Cancer can occur in your brain. Cancer can occur in your eyes. Cancer can occur in your breast. It can occur in your womb. It can occur in your prostate. It can occur in your liver. Cancer can hit any part of your body.
Okay, so if I can cut you short, I believe this is really, it's getting really interesting already. But we were going to be blasting you with a lot of questions, because I believe our viewers have a lot to ask you, just same as we too. So in actual sense, how can one know that you've got cancer? How can you even sense? Because they've been saying so many things, to the point that I know someone, when he feels back pain, he thinks, oh, what is happening to me? Is this one of the things? Like, there's so much information that we've gathered in the wind that are not coming from professionals like you. So sometimes we end up scaring ourselves before we actually get the chance to meet the right professional. So how can one know?
Okay, that's very good. There are different signs that you should expect based on the sites that cancer is emerging from. So the signs that you should expect from cancer of the eye is different from cancer of the breast. It's also different from cervical cancer. It's also different from prostate cancer. So in general term, to make this education effective for you, we have an acronym that we call CAUTION. CAUTION. C-A-U-T-I-O-N. CAUTION. So the C stands for, you should look for change in your bowel or bladder. Change in your bowel or bladder. So please, you know
when you say bowel, please break it down.
you know
why is my bowel? Why is it? Is it, viewers, sorry, those of you that are aware, who know what bowel is, I just want us to be able to educate everyone. So what is bowel?
So we will show images that direct how your bowel is located in your abdomen area, and you know how when you eat, it has to go through systems for the food to be processed. Then you take the nutrients from the food, then your body will utilize the nutrients. The waste should come out. It should come out.
So physics,
yes, it should come out. It should come out through your intestines, through your rectum, then your anus. So we have the body, the human system is a complex system. It consists of cells. then you combine the cells. It consists of organs. You combine them, then you have a system. So every system is unique and perform different function.
Yeah.
Your respiratory system is unique. It perform respiratory function.
Yeah.
Your nervous system is also unique. Your cardiovascular system is also unique. All these systems combine, then you get a unique human body. So cells will combine, then you get tissues. Then tissues will combine, you get organs. Then organs will combine, you get systems.
Okay.
And cancer, most of the time, emerges from the cells. That's the basic unit. That's where it emerges. If there is a mutation that occurs, then cancer is likely to emerge. So back to the signs and symptoms you should look out for. The first is change in your bowel or your bladder. You know that I always say that every human being, you should know your system.
Yeah.
You should know your body. You should know that, okay, every day I visit the washroom 3 times a day. I visit the washroom 5 times a day. So you know your body. Then all of a sudden, for the past 1 week, you've not visited the washroom. This is a change that has occurred in your bowel. Or all of a sudden, within a space of 1 hour, you visited the washroom for about 10 times. This is a change.
But will that have something to do with the type of your eating habit? If it has
It
changed,
could be if your eating habit has not even changed. You know that the same food, your rice, all of a sudden you are visiting the washroom, and this is continuous for about 1 week or 2 weeks.
Yeah.
And it is not normal to you because you know your body.
Yeah.
I always say that as soon as possible. It could be anything at all. It could be anything, but it could equally be cancer that is emerging from either your rectum. It could be cancer that is emerging from your small intestines or your large intestines. So see your doctor. Okay. And your bladder, you know that when you are urinating, it does not break. You know your urine system. You know how you urine. And you know that when you are urine, it is sharp. It is well curved, but over some times you see break, and even when you go to the washroom, you strain before you pass your urine. It's a change that has occurred in your bladder. It is not normal to you. You know your body. See your doctor as soon as possible for further diagnosis. It could be bladder cancer that is emerging, or it could be prostate cancer that is emerging. Maybe your prostate is getting enlarged, so it is putting pressure on your bladder. See your doctor. The second symptoms you should look for is the A, which we call a sore that does not heal. It could be that you've seen a sore around your breast. It wasn't there, but overnight or within the past 2 weeks, you've noticed a sore around your breast. It could be a sore in your armpit. It could be a sore at your genital area. It wasn't normal. It wasn't there. So as soon as possible, it could be anything. I'm not saying it's cancer, but it could be cancer of the vagina. It could be cancer of the cervix. And if it's around your breast, it could be cancer of the breast. So as soon as possible, see your doctor for further diagnosis. Then the U is what we call the unusual bleeding. You know your menstrual cycle very well. I would say know your system, know your body. So you know that, okay, your menses, it lasts for 5 days, and you know the flow. But all of a sudden, it has changed. And equally, when you are going to pass urine, you've started noticing blood in your urine. It is not normal. See your doctor. It could be anything, but it could equally be cancer. So see your doctor. And also, you've noticed that anytime you cough, there is blood in it. It could also be cancer of the lung. So see your doctor. Or you've noticed blood from your nostrils. It could be nasopharyngeal cancer. So see your doctor. There are a lot of cancers. The next symptom is tickling or a lump in any part of your body, especially your breast. If you've noticed a lump in your breast, which wasn't there, see your doctor. If you notice a lump in any part of your skin, it wasn't there, see your doctor as early as possible. Then the next symptom is indigestion or even difficulty in swallowing. It should not be an issue when you want to drink water or when you want to take in food. But for the past 3 days, you've noticed that anytime you are taking in water, you find it difficult. And anytime you take in food, you find it difficult to even digest. You are getting indigestion. It is not normal. It could be anything, but see your doctor as early as possible. The next is obvious change in what or mole. Some people have moles at the genital area or what on their skin. So you know your skin very well, and you know the what that possibly you have on your skin. But overnight, you've noticed that the what or the mole is changing in size and shape. It is increasing. It could be skin cancer. As early as possible. Those of us in Australia, you know that skin cancer is very common. Yeah. As early as possible, see your doctor for further diagnosis and treatment. The last symptom you should look for is what we call nagging cough. Nagging cough. You've been coughing for over 1 or 2 weeks now. You've taken all the medications that was prescribed to you, but it is not going. It is not normal. See your doctor for further diagnosis. It could be cancer that is emerging. It could be cancer of the lung that is emerging. It could be cancer of the larynx that is emerging. So see your doctor for further diagnosis.
Okay. Thank you so much. So these are the various symptoms. Yes. This is full on. But I would want you to do us a favor. This is for the sake of our viewers and the different cultural backgrounds or different people that are watching us, viewers, I want him to help us to try to talk about this a little bit in a different language, so that we can just have 1 minute. Viewers, those that don't understand it, it's just going to be 1 minute just to run through it with the Ghanaian language, so that we will see Sunday beti asie kakra. It is ngebe me aboboso kakra bi a.
Okay, me bomodin akatwi no. Me bomodin akatwi no, twi ni mu ayedin but e be kan. Yes say enoma ebre ho a obetumi ehu e be kire say bia wonya cancer na say wonya cancer. Na say wonya jebisa. De edi kan ye say bia the way a wokọ ejanan amu asesa overnight. Ebia na wokọ 3 times. But all of a sudden, you know, as a sign, more than 3 times, you know, Okonso crampa, blood crampo womb, and I say Oko Johnson crampa, moja womb, and I say Oko Johnson cra, Bran Sana, Johnson I day, Abba, Brepa, and Sana Johnson Abba, and now Oko a Janan so crampa, Bran Sana, Ebi crampa, Abba, Ebia for the past 1 week, Ranut Minja or 9, and yet normal, a bit me Arabia. But a bit me aside cancer. Intimate na ho emfa edutwa ona sekra. Kohu doctor.
Just a minute. Viewers, I know somebody when he travels to a new place, he can stay for a full week. One of the sisters, she said, look, if I travel to a new place, a strange place where I've never been, I can go without using the toilet. I said, on toilet, na what you cry on COVID. Ono do ni me ho se fi nkwalabrem sa anote. So what the answer say?
It could be psychological.
Yes. To be an obo baby or more come before on your comfortable so be kwa na be na agena switch off crampo on shada crampo ebe on akra nam say to shada ni di or be place and you know what the end of be what the nyini fi collaborate ma me
yes
but o ka obi a what the end ntisa ada na afi wa hwe within maybe some short time, 1 month, 2 months, 3 months, 1 year, you know, as a sound.
Yes, it could be psychological, and then they remember in ye and cry. Why? And at the Tosu BME, say, be a woman, a crowby, a wall, Wunufuano, and I say, or private parts, and I say, skin baby, that's how chrono in Wuda. Say crone bi and that okra put that but all of a sudden na abeto ho memfa nye empire bosem fako hospital ne ko hu doctor no mo nye enhwemu ente betumi aba say bi cancer ebeto wo nufu ana say cancer ebeto wo private part ho no ena de etoso biem say bia won hu moja efri uhunim won hu moja obowa won hu moja wom won hu moja efri ukọ ejanan so a won hu moja wom enye normal ko hu doctor no mo nya nhwemu ma ena so won hu say ababi abeto wanufum na saa aba no nso wa woni monufu na ababi a enye den endem but saa aba na betom overnight bi no do nsa eka outumi say aba na movie a patcho foko hu doctor no mo nya nhwemu ye was several tests or why betumi run ni hu say ye breast cancer ena major na say ye breast cancer ena de tosu bi say bia udidi a o finding difficult ansa na digest and I say bia o num nsuo krampo a o bre ansa na wonum nsuo udidi krampo a o bre ansa na wetumi amne aduane na ebetumi aye cancer atọ minim enti fako now doctors enye den enhwehwem emma ena de etoso biem say bia na what anase mo ebi wo skin no ohonam nim ena overnight when we say kese changing shape ebetumi aye skin cancer enti fako na enye de enhwem ma
what anamo
ebe ye den se meka ni twi mu ba
yan describe no kakra hwe say minim so ode wonim adekwa what anamo say bibi enhwie bi epo bi say na ekuro aya bibi atwu na ewu na eho na aya rough bi sa na bibi sa na
wo trim de be di yama mi o
that the picture bi on na
ya to the picture betu
corner no be no be hu say bibi da ho a ese bibi ti say the what anamo na o kana na ya de achem na ya timi anya de ni to
ena de tosu bi eme ye wabo for about 1 week 2 weeks wako hospital ya mount draw but still what I want no it is very very important say you be call the next step of the diagnosis ni ahwe say bia lung cancer ena ye den eyiniti ana say bia laryngeal cancer bi krampo na eyiniti efri ho because obo wa ni nyina na enye normal kra ena bi krampo a obo wa na emoja eden esa di ekire enye normal ko ni enye ehwemu emma
okay but me one question
the
question is we say a chrono, does it just appear as a chrono? Say I'll see something that has like something will come first before it's passed, then it turns to a chrono, and I say the chrono will just appear, or maybe irritations be an heat be an pain be the band sana the chrono be about the tunnel. That is
so everybody is different. Everybody is different. Your skin is totally different from Oti's skin, and equally different from my skin. How the wound may start emerging is different from. It's unique to individuals. Somebody may start feeling it as itch, then gradually may even see rashes, then overnight will turn into a wound. So know your body. That's the hallmark. Know your body. There was no rashes around your nipple. There was no rashes around your genital area. But all of a sudden, you started seeing those rashes, and gradually it has turned into a wound. Some may not even see any rash, but overnight you tell, oh, I did not even see a wound, but my child was breastfeeding. I even thought my child gave me a bite and I saw it. Everybody tend to give different experience altogether. So I would say that know your skin, know your body, and always monitor changes that is occurring day in, day out, so that you'll be able to report to your doctor when you see anything that is not normal to you.
Okay, I also want to ask about some discharges. Like if maybe the breast cancer or cervical cancer, prostate cancer, will there be any discharges, like aside from urinating and seeing blood? Will there be any other discharges that I will see, or like some abnormal discharges with bad odor and stuff that I will see?
Yes.
So that,
So the symptoms that I gave, they are the what you call causing general principles. General, but when we are going to the details of the various cancers, for example, cancer of the cervix present with offensive discharge.
Right at the beginning?
Offensive, not right at the beginning, but it goes through stages.
Okay.
It goes through stages. Some will find it very painful during sex. Very painful during sex. And equally, some will start seeing blood after sex. But the offensive discharge should tell you that there is something wrong with me. Let me see my doctor for further investigation.
Okay.
Koda TV, reconciling humanity to the source. Stay blessed.
So I had my